This is a 76-year-old female admitted for a double valve replacement, which was an aortic and a mitral valve, also a coronary artery bypass graft. She had a past medical history of coronary artery disease, osteoporosis confirmed by a DEXA scan, and prior to the admit, she was active in an independent community ambulator. She developed several complications post-op, including aflutter, cholecystitis, respiratory failure, and she became vent-dependent, requiring a tracheostomy, and was immobilized for 12 days due to hemodynamic instability. For the PT eval, she was alert, communicated with head nods. She had marked abdominal distension. Her upper extremity strength was fair, but her lower extremity strength was grossly poor, and she was dependent for all mobility skills. Okay, so we were unable to begin standing due to severe weakness, but we need to really begin early weight bearing. So we're going to use Moveo, and she's up about 30% of her body weight right here, and this is really something that she can do independently. This workout will consist of lower and upper body exercises. We start out with around 10 to 15 incline squats and then switch to some assisted shoulder exercises while she's weight bearing. So she's having to actively hold herself up. And we're constantly monitoring vitals, making sure we get a stable response. Okay, you can see a few days later, her trunk stability is starting to improve. Again, we're continuing with Moveo treatments. This is her husband down at the end of the Moveo, really encouraging her to exercise and use her leg muscles. It's one thing that we've found is it's not only great for the patients to see how they're progressing, but also for the family members to see that their loved one is progressing. It's a few days later, and you can see she's now able to begin standing with a two-person assist. However, it does require maximal assistance, and she's only able to stand for a few seconds. About a week later, and she has much improved sitting balance. Okay, this is a co-treatment with OT and PT, progressively working on standing for longer periods. She is still very deconditioned, however, requiring a maximal assistance of 2 and working on that upright posture. Still working on partial weight-bearing strengthening using the table, especially on days when she didn't feel well, because this is a much lower intensity exercise than upright standing. Here we've progressed to standing with a platform walker, standing for longer times. And you can see that piece of paper in front of her. That's actually a crossword puzzle, which she enjoys doing. So we're using that to kind of distract her while she's standing, and so we can begin standing for longer periods. Okay, this is now where she's been weaned off the ventilator. She's on tracheal collar. And again, we're moving down to a low-intensity exercise using the Moveo, and also still working on trunk control and sitting balance. You can see now the patient has been weaned off the ventilator. And finally, we can get her into a wheelchair and take her down the hallway, take her outdoors, which she really wanted to do.